Welcome to the Four Eyes podcast, brought to you by YoungOD Connect. We give you a clear view into the new grad optometry world across Canada and the US. We are your hosts. I'm Dr. Deepan Kaur.
And I'm Dr. Amrit Bilku.
Okay,
yeah,
perfect.
We're so excited to talk to you. We've never had you on the podcast.
Yes.
But you're such a celebrity that we're like, we need to talk to Carly.
Yeah, you've been on our list for a while, Carly.
Yeah.
Well, I'm honored. I'm humbled. Thank you so much. Obviously, that's just always going to be a foreign concept to me,
Yeah.
We're just optometrists.
Like,
what?
Why do you want me? No, you're No, but I mean your Instagram is so educational too. Like it's really easy to follow, especially for the public to understand what you do, the importance of dry eye. And, again, we're excited to talk about the aesthetic services you provide in your clinic. So no, we're just so excited about this topic that we decided to share it as well. Yeah.
Yeah, I know. I'm excited. It's crazy to watch it all unfold. That's what's exciting about our profession is we can really watch technology evolve right before our eyes. It's so crazy.
Yeah.
Yeah.
Why don't we just jump on in, Carly? Why don't you introduce yourself and give us a little bit of your background history for all of our listeners on Four Eyes?
Yeah, so my name is Carly Rose. I am an optometrist in Cincinnati, Ohio. I went to optometry school at ICO in Chicago. I did residency at the VA here in Cincinnati. And I kind of always knew I wanted to jump into private practice ownership. I was in private practice club in optometry school. I tried to buy a practice while I was still in optometry school. So I just knew that I actually was never planning on doing residency because I planned on just going straight to private practice. So the way my path has unfolded has actually been completely outside of my control, I think. It's kind of evolved from a mind of its own. And what ended up happening in this journey is my older sister is also an optometrist, and she opened cold a few years into practice. So she had been a practice as an associate in a private practice. And then opened cold in our now hometown and ended up not enjoying the business admin side of practice ownership, right? That's a really good lesson to learn. And since I've been talking to people, that's kind of my lesson I've been telling people is don't do ownership. And this is, I'm sure we're going to get into with the dry eye stuff. It is all in alignment of don't do it just to say you did it because it is still hard work. It's another job. It's it comes with its own challenges. But I was ready for that. So it took about 8 months. And what ended up happening is I bought her practice after she had opened it about 5 years in. I purchased it. And then right away started an internal dry eye clinic. So I knew I wanted to do dry eye right from the start of my practice ownership. And it just takes a little bit of building.
Yeah. Okay. That's amazing. I did not know that your sister was an optometrist too. And that you bought her practice.
Is she still practicing at your practice now?
Okay, right. So many questions. So what ended up, I'm trying to think if I can get this timeline straight. So what happened is she stayed on a couple days a week and worked at another place a few days a week and did that for a little while, a couple years. And COVID happened and her and her family decided to sell their house, buy an RV and travel the country for a year.
I love
that.
I love that.
So then, and she would come back into town and practice, in spurts. And then she came back, started practicing. And through, networking, this is such a small profession. I've been talking to a bunch of people lately about that is an opportunity presented to her now a few years ago, I think, if my timeline's right, to be an MSL in industry in a biopharmaceutical company. So she's
Oh,
now
great.
no longer in patient care, but that didn't happen after this right away. She
Yeah.
Yeah.
stayed on in patient care, but then traveled the world and then came back, and it just all unfolds how it's supposed to.
Yeah.
Oh, lucky girl. I was one of those jealous ones when everyone was traveling during COVID. They were all like, we work from home. We're going to work from Mexico for 3 weeks.
Yeah.
I was like, okay, I'll be in my mask, at the optical, at the clinic, just
Yeah.
hanging out, waiting for walk-ins.
Yeah.
Not a fun time. It was
Exactly.
not a
I
fun time.
know. I was
Yeah.
right there with you. It was a crazy thing to
Yeah.
survive. And right around that time, what ended up happening is over the years, the internal dry eye clinic expanded beyond the four walls of the primary
Awesome.
care.
Yeah.
So I opened a secondary location,
Yeah.
cold started half a mile down the street.
Yep.
And that's where the dry eye med spa came from.
Oh,
Yes.
wow. And that's what we want to really get into
Mhm.
because it's such a unique way to practice even dry eye specialty in optometry. And, with more research coming out with dry eye disease and all these wonderful treatments, we're seeing that there's that overlapping aesthetic side. And I think for all the new grads and all the students that are listening to this podcast, hopefully listening through your journey and what strategic decisions you made in opening that clinic will hopefully give them more motivation to kind of follow that path if that's what they find to be the most fun part of optometry for them.
Mhm.
And so we want to go into with clear eyes and aesthetics. How did you decide on what aesthetic services you were going to bring into that in addition to the dry eye services, that the bread and butter dry eye stuff that you already provided in your primary care office?
So it was a bit of a natural unfolding. Have you
Hmm.
guys, do you know Elizabeth Gilbert? She's an author. She
Yeah.
wrote Eat, Pray, Love.
Oh
Yes.
yeah.
I've
That's
heard of her
her
name.
most famous. She has a book called Big Magic, and
Hmm.
it talks about this idea of these concepts are like not our own, right?
Hmm.
These ideas pass through us, and whatever we decide to do with them is, kind of like on us. That's
Hmm.
the free will component, but like not to attach ownership of these ideas and these concepts.
Yeah.
So I kind of say that this has evolved a bit out of obligation, out of necessity,
Hmm.
and of course, design and intention, but it's the mixture of all of them. So, what started me down this path initially was investing in the IPL.
Yeah.
Mhm.
So in 20, I had started looking at the Luminous M22 way back in the day. It was like 2018, 2019.
Hmm.
Mhm.
And my primary care practice is only 750 square feet.
Okay.
So teeny tiny. And at this point, I had two exam lanes, a full optical, a Humphrey visual field,
Hmm.
a LipiFlow, a LipiScan, autorefractor, Optos. I mean, we were
Wow.
squeezing things in here.
Wow.
Yeah.
And I'm
Yeah.
like, how am I going to bring this giant R2D2 machine into, I don't have anywhere to put it.
Yeah.
And I sat with that for about a year, year and a half of I really feel like I need this for my dry eye patients, but I don't know physically how I'm going to do it. And
Hmm.
so, and we got really creative. We brought it in. That's kind of that, and the mascaras and the makeup cleansers
Hmm.
are
Yeah.
what got me into the aesthetic world, kind of
Yeah.
like learning what they could be doing to the ocular surface.
Hmm.
Let me tiptoe into the aesthetic world. And then I started looking at things like liner tattoo and what it does to the meibomian
Hmm.
and lash extensions and what those do to the meibomian glands and LASIK and upper and lower blephs,
Mhm.
which led to crow's feet Botox, which led to you can
Hmm.
actually use Botox to help dry eye. Did you guys know this?
No.
You can
I didn't
act
know
like
that.
a temporary punctal plug.
Oh.
Oh,
It's fascinating stuff what you
so
can do.
cool. Yeah.
PRP injections into the lacrimal gland. There's a
Wow.
lot of crossover. It's almost like the crossover didn't stop once I started looking. So
Hmm.
you ask how I decided. It has fully been an evolution because on top of that, think of how much dry eye disease has changed from 2018.
Yeah,
Yeah.
I mean,
definitely.
come on.
Yeah.
We
Yeah.
now have radio frequency and I can't even mask and probing and PRP
Mm-hmm.
and Oxervate, right? Like
Yeah.
we have
So
so many
many.
things we did not have then. So it has to evolve and
Yeah.
pivot over time.
So are there any aesthetic services that you're currently learning about or you think that you may end up evolving again and adding more to the practice? And or are there any aesthetic services that you are not willing to add to your clinic because, right? Like
Ooh,
things
good
like
one. Yeah.
lash extensions, tinting, like are you going to be adding those too or are you
Yes.
staying away?
Good question. So I never say never.
Yeah.
One day there may be a healthy lash extension, right? I was
Yeah.
actually just talking with a local optometrist this afternoon about he's a private practice owner with a co-optometrist, two guys,
Hmm.
and they're getting into clinical studies. And we were just talking about the flexibility that private practice offers
Yeah.
and like choose your own adventure. So never say never because I think I was telling him that I predict my clinical study wants to be things like PRP eye drops.
Mhm.
I predict are going to grow eyelashes. So
Oh,
like
Oh.
in a dream world, we could get rid of Latisse. I hope I
Hmm.
yeah.
don't get sued for saying a brand name derogatorily. Like, I don't think prostaglandins should be on the market. So if
Yeah.
we can
Yeah.
find a healthy alternative,
Yeah.
right? So if
Of
there's a
course.
healthy lash dye out there, by all means, I would offer it. But
Hmm.
I
Yeah.
just have to see the benefit as well as the aesthetic reward.
Yeah.
Okay.
So
Yeah.
true.
Yeah, I mean that makes sense. I feel like every time we look at social media or, education in optometry in general, we're always against like lash extensions and tinting and all of that. But honestly, like a lot of my female patients do have it, and it's kind of like even though you'll explain and educate all these different things, they're like, "Well, I mean, I get what you're saying, but I'm still going to keep on doing this." So
Hmm.
if there's like a healthier alternative, of
Yeah, it
course, why
becomes
wouldn't
more
you?
like risk mitigation
Yeah,
Yeah.
instead of
exactly.
opposition, right? We should
Yeah.
be partners with our patients and like
Yes.
Yes.
really
Right.
help, okay, tell me your authentic lifestyle and how can I
Yeah.
support?
Yeah,
Yeah.
exactly. And I think, yeah, Amrit and I really believe in that, like working with our patients instead of saying
Hmm.
yes or no, this is not going to work
Yeah.
versus this is going to work. So I like that different perspective on this. I wasn't expecting you to answer that question that way, though. That was kind of a surprise. So I'm glad there could be potential for more safer alternatives
Yeah.
for lash extensions and etc. Um, but Carly, so like when you're, first introducing this kind of service to your patients, even during like a simple slit lamp exam, you and your associates, what are you guys kind of looking for besides dry eye disease when you want to bring up these aesthetic services to them?
One thing I think that is super duper easy and often overlooked that we should all be doing is physically touching our patients. So we need to
Yeah.
feel their lid laxity. We need to
Hmm.
feel their orbicularis oculi strength. We need to be really evaluating the mechanics of the blinking of the tear production. You know, any kind of like micro organism overload we need to be addressing. It really is a multi-step approach.
Hmm.
Yeah.
It's just like glaucoma. You can't only look at pressure and only look at the cup to disc. You really
Hmm.
have to look, you have to look at the angles, you have to look at family history.
Yeah.
Hmm.
So I think always I make them close their eyes. I evaluate their upper lids. I look at their lashes. I look at their cheeks and
Yeah.
nose. Look at their whole face. Look at
Yeah.
how they're sitting. You
Yeah.
really have to look at the whole patient and not just zero in on a nerve and a cornea.
Hmm.
Yeah.
Yeah.
Okay.
Very true.
That makes
Take your
sense.
time. Yeah, take your time. Vital dyes are highly underestimated. Get
Hmm.
yourself a
Mm.
handheld Ratten filter. That'll make it
Yeah.
even easier to see corneal issues.
So if you're even looking at a patient and you notice some crow's feet and would you like introduce that as, oh, I see some wrinkles here and they're only 35 years old
Oh,
and you're just like,
I
oh, I can
actually
help you with that. Or is that kind of like, let me see what they say about it
No,
first?
actually, never. I never do that. What I do is I always ask them their personal goals.
Okay.
You would be shocked how many times even men bring up the
Mhm.
cosmesis of
Yeah.
their disease, the
Oh, okay. Yeah.
redness of the lid margins,
Yeah.
like always looking upset
Yeah.
Mm-hmm.
is a huge thing. So I just ask them, what are your goals? And they
Yeah.
will bring it up themselves.
Wow.
And or what I do is I take those treatment spots. So, we get them lined up for treatment, which is usually a series of four, a couple weeks apart. So what I'll do is while I'm doing treatment for dry eye disease, I will say, are there any spots you want me to focus in on? Are there any spots you want to keep?
Hmm.
Because this machine's side effect is it can lift reds and browns as well. What
Yeah.
do you want me to pay attention to or avoid? And I let them tell me.
Yeah.
Yeah,
Okay.
that's a really nice, smart way to
Approach.
do it.
It
Rather
is
than
a
looking at them
journey.
and being like, I can fix you if you
Yeah.
can you
Yeah, because that
imagine?
does not work,
Would not
right?
But
work.
I'm sure there's things at the back of your mind where you look, because you're quite experienced in this now, where you'll meet a patient in the first minute. You'll be like, yep, I know I have a list of certain
Hmm.
things here, but let's just see what they
Well,
say.
you're exactly right. And there's a
Yeah.
way to do that. I might walk in and it's the worst case of rosacea I've ever
Yeah.
seen. And so I immediately go to this IPL is all indicated to treat rosacea. A
Yeah.
happy side effect of that is calming the redness of your face. I
Yeah.
make sure to say that
Yeah.
because that is also not only can affect how you present yourself in
Right.
everyday life, how you feel about yourself.
Yeah.
It can be physically painful when your skin
Yeah.
is inflamed. And
Yes.
Yeah.
so I
Yeah.
also, what I will do in those moments, if I can sense that, like you're saying, pick up on what may be bothering them,
Hmm.
I also start talking about things like the link of gut health with rosacea and lifestyle
Yes.
changes about that and skin barrier and topical vitamin C. And we
Yeah.
also carry intense recovery cream products that
Great.
some have
Yes.
has steroids in them, right? Or we could do a
Mhm.
topical ivermectin. So I actually just opened the door of we can do more than just
Hmm.
this, right?
Yeah.
And how can we help support you in that journey?
Yeah.
Yeah.
Perfect.
I love that. And so, speaking of all these additional services that you can provide, leaning more towards those more aesthetic procedures, I'm not sure 100%, so you can verify if you're also providing services like fillers and injections at
Mhm.
Clear Eyes and Aesthetics. Are you
We
currently?
are,
Or
yeah.
yeah,
So we do chemical
great.
peels, microneedling,
Yes.
PRP,
Yeah.
PRF. We're doing all kinds of stuff.
Yeah.
What we there are some things that I've have been a little almost like passion projects of mine for selfish reasons, right? So
Yeah.
we touched a little bit on this idea of filler and tox can be helpful or harmful or
Hmm.
neutral,
Hmm.
right?
Yeah.
And so we know under eye filler comes with risks, not
Yes.
only risk of filler migration, and it just might not age well, depending because that's such thin tissue, but the artistry of how the filler is placed and the location of where the filler is placed is paramount. So, this is where the skilled practitioner is everything.
Yeah.
But a way around that is something that I love very much, that has been the passion project for almost selfish reasons, is PRF injections.
Hmm.
So, it's kind of like PRP where we pull the patient's own blood, we
Hmm.
spin it down to platelet-rich fibrin, and that is a lot thicker in
Mm.
consistency than PRP. And so that can be an under eye injectable replacement. So it adds volume, but what it does is over the next 28 days, it releases stem cells and all kinds of growth factors to
Hmm.
actually rebuild the collagen
Oh,
from the
wow.
inside out. So it is changing skin texture, skin tone, and adding volume. It really
Hmm.
is regenerative. Think of the blood biologics we're using on the surface of our eye.
Yep.
We can now inject it as a filler substitute. And then you grow your own under eyes over time. And it's usually a series of one every couple of months and then a maintenance annually. There's so much
That is
crossover.
so friggin' cool.
So my friend,
I'm looking
I
at
know,
my under eyes while we're talking, and I'm like, oh my gosh, I
I'm
need to try
obsessed
that
with
too.
it. So what I think is, are we bathing the meibomian glands and stem cells as
Mm,
well? What are we
because it's
doing to
close by.
those? Because we are injecting blood biologics.
Yeah. Wow.
Well, so like all this information, me and Amaranth are kind of hearing this for the first time.
Yeah.
What resources are you using to educate yourself on this? And
Yeah.
speaking of like the fillers and injections you provide at your clinic, how do you even find a proper practitioner for that? Like, how do you
Yeah.
trust that person where you're like, okay, I know the chances of these certain risks will be less
Hmm.
versus another nurse practitioner or whatever?
That's kind of like how do you find a good man, right? Like, where do you even start? I
Yeah.
think you literally just have to start. You put
Yeah.
yourself out there, you talk to people, you
Yeah.
see who is in the area injecting. Are you in a state where you can inject yourself,
Hmm.
right? And
Yeah.
if so, please get really good. Please
Yeah.
don't give us a bad name and just start
Yeah.
injecting people
Yeah.
because you
Yeah.
can. So if you're going to do it yourself, please don't give our profession a bad name, and get really
It's so
good. And
true.
if you're going to hire out, which is what I did, oh my gosh, heavy
Okay.
networking. What ended up happening is I hired an optometrist
Oh.
to be my associate at my primary care office. And his wife is an aesthetic nurse practitioner. And I had already been going to her previous practice as a
Oh.
Oh.
patient. Like it was, but it took years. It took
Yeah.
years to find the perfect match, right? So
Hmm.
don't settle, but do your due diligence,
Yeah.
please.
Yeah. So
So then in
obviously don't
terms of
jump
like,
into it.
yeah, don't jump into it right
Don't
away.
jump into it.
But also then are there any specific resources, conferences or websites or articles that you would recommend for students and new grads to kind of look into if they're
Yeah.
also looking into working at a dry eye aesthetic sort of a practice to learn
Yep.
more?
Oh, like where to even start. That has
Yeah.
unfolded as well. My journey took me quite a few places. And these are like not totally affiliated, but some of them are now my resources. So I'll give disclosures.
Yeah.
Um, AmSpa is an organization that is American Med Spa Association. They have
Nice.
aesthetic boot camps that I have been to. I learned a ton, kind of like a crash course.
Hmm.
There are aesthetic attorneys who you can call and get
Oh.
guidance by state.
Hmm. Love that.
Um, the optometry boards, I always recommend calling and asking, but I would say be a little bit more aggressive even than the boards,
Hmm.
right? So they just maybe can't keep up as well. So when in doubt, talk to attorneys, talk to your colleagues, call the board. These laws are changing pretty rapidly too. So
Yeah.
this is disclosure. I just joined the American Optometric Association. They just launched an aesthetic task force that I just joined
Oh,
to
that's
try to
great.
kind of aggregate all of
Yeah.
this information.
Great.
And then also, what else? Okay, Facebook groups. I am in a few ocular surface disease Facebook groups that have a lot of valuable information. I started an aesthetic optometry Facebook group kind of for these questions. I don't know, maybe in 2021, something like
Hmm.
that. It's pretty valuable at this point as a resource.
Hmm.
And then, like I said, talk to our tiny, tiny community, right? The people
Yeah.
that are
Mhm.
doing this are willing to share because it's kind of like paving the unknown frontier. It's
Yeah.
ever
Mm.
changing.
That's amazing. I will add all of those resources kind of in the description box for anyone who's
Yeah.
interested, but you're so right. It's for any specialty. You really want to dive in by shadowing, working at these clinics that already offer these resources and these services because we're going to end up being mentors for those people, right? Just kind of teaching them how to do specialty optometry. Um, Actually, I wanted to kind of lean into that. I know we're going a little off topic, but because of that, I just wanted to bring up the fact that your practice is one of the few that offers a dry eye specific residency program in the
Oh
States,
yes,
correct?
we also have a residency.
Yes. Are you guys the only one in the States that offers that right
Well,
now?
we are not technically, there is no dry eye title, right? So our
Yes.
technical title is primary care with an ocular surface emphasis.
Got it. Got it.
Yeah.
However, we are a quite unique residency setup. So
Yeah.
I would venture to say we are one of a kind. Yes.
Yeah. That's amazing. I won't take too much time on that since we wanted to talk a little bit more about the aesthetic, services, but actually, well, you know what? If someone is looking into getting into the aesthetic part of dry eye disease and dry eye specialty, what exposure does your resident student get? And how has that experience been so far, having a resident for the first time?
Oh my gosh, it's kind of like starting a business and you never know what you're going to get until you do it. It's really like parenting too. I don't
Yeah,
know if you guys have
yes.
kids, but holy moly, you just don't know you can't prepare.
Yeah.
Um, it has been such a teaching adventure for me. Or like for me to be taught, I should say.
Yeah.
I have learned so much in this adventure. This started years ago, starting a residency, and then going through the first year is the hardest
Mm-hmm.
because you have to do what's called a self-study and site visits, and
Yep.
ooh, it's like one of the biggest school projects you could ever imagine. And then it's been crazy. So
Yeah.
currently our schedule is the resident spends mostly 2 days at one practice doing primary care and myopia control. So we have a
Nice.
specialty down at primary care. We do ortho K, the soft contact lenses, and then atropine down
Mm-hmm.
there with optical experience and primary care
Got
experience, and then 2 days at clear. And the way we have it structured is the biggest priority is they have to nail dry eye, right?
yes.
Mhm.
So they have to be able to do all the advanced procedures, explain it to a patient, and really understand it, on top of keep up with the ever changing studies. I just heard a new med is coming out this year, right? So we have to be able to know
Mm-hmm.
everything about all the new things coming.
Yeah.
So they do have to keep up on that. We also have them do different didactics, right? Different posters, different lectures, different continuing education, and we want them to prove independence. Now, depending on how quickly they get to independence, we can then layer on what we're kind of tossing around as almost like an elective, right? Do you want to deep
Mm-hmm.
dive into business ownership? Do you want to deep dive into aesthetics? Do you want to observe the nurse practitioner? Do you want to observe the esthetician? Do you want to go to AM spa? Exactly.
Yeah.
But we have to be able to nail the basics first. So we
Mm-hmm.
start there and then go. That's the pick your own adventure side.
Okay. And then for these, because yeah, you're right with dry eye stuff, you constantly have to keep up with the latest
Oh yeah.
information. Where are you getting the latest stuff currently? Or like what's your go-to so far?
A few different places. Go to our good ones. Obviously colleagues, we've already touched on that quite a bit.
Hmm. Yeah.
Patience, man, oh man, if you put your flag in the ground as a dry eye doctor, they will find you and you should listen to them
Yeah.
Yeah.
because they have been in this world much longer than we have. They are also keeping up with the latest and greatest
Right.
research.
Mm-hmm.
Yeah.
We really should humble ourselves and listen to these people and investigate, right? Of
Yeah.
Yeah.
course, med, because we are a residency,
Hmm.
we have access to ICO's library, which has been an incredible resource for us. And
Yeah.
I stay fairly involved with industry. So I talk with reps on both sides. So not only do I stay up to date with the dry eye reps, you've got to think I'm also talking to all the aesthetic reps. So
Yeah.
I'm hearing about this technology years ago before they make the crossover. So
Yeah.
all of the above.
Forever learning. We talked about
Yeah.
this with a previous guest on our podcast too. It's just when we speak with all these amazing ODs that really go into these specialty areas of optometry, it really is because we are forever learners, right? We're always wanting to learn more. It's not just optometry school taught us everything and now we're good. It's we're
Right.
right. We're constantly evolving, learning, wanting to learn more. We're looking for that knowledge so that we can then, um, experience more in some specialty area that really, lights our passion for our career. So yeah, that's why Carly, you're one of the greats because you're a forever learner, and that's what it is. Um,
That the more we learn, the more we can teach, right? And
yeah,
be the
exactly.
permission slip for others. Exactly.
But
Yeah.
I also think you're a perfect example of a really confident optometrist
Hmm.
delving into different things. Like you're not afraid to like try something new, which I feel like some
Yeah.
of us can be like really hesitant. Like we have to look at all like the whole checklist and be like, okay, is this okay? Is this okay? Is this
Yeah.
okay? Because we're quite risk averse, right? But I feel
Right.
like just how you're speaking, like how passionate you are
Yeah.
about trying these different things. Um, like my next question is, what did you find the hardest part about transitioning into all these different things, or even incorporating a full aesthetic service clinic into your already successful dry eye
Hmm.
optometry
Well,
clinic? Like,
it's funny because I have just recently started diving into the world of burnout and like burnout within
Yes.
optometry.
yeah,
I
Yep.
think I've been really practicing burnout digestion and
Mhm.
prevention over the last few years. I've been trying to really prioritize things like meditation and
Yeah.
yoga and
Yeah.
getting outside and community. And so I think if you're going to kind of, push yourself into the scary things, you have
Hmm.
to be resourced. You have
Hmm.
to plan for the fear to come into your brain and then have the tools to digest it.
yeah.
That is amazing advice. That's what we should learn in school,
Yeah.
honestly.
Well,
No,
I mean, I am submitting lectures to Academy. Someone at
That's
Academy,
good.
accept my burnout lectures,
Yeah.
please.
yeah. Well, no, it's true though, because,
Yeah.
as optometrists, you are business owners too, but that
Hmm.
is definitely something you don't learn a lot about in school. You just kind of have to figure out everything on your own. And it does lead to these certain feelings and kind of mental
Yeah.
exhaustion, right? Because if you're
Mhm.
doing all these different things all at once, there's only so much fear your brain can take and so much
Yeah.
fear your body can take. So, but yeah, again, you're just a perfect example of like, all these different things you're delving into, but still trying your best to take care
Hmm.
of yourself and
Well,
being
I'm
open to
going
talk
to
about it.
challenge you. None of us are perfect examples.
Yeah,
So
well, that's true. Yes.
also
You're close to it though.
don't take the highlight reels. Don't take the
Yeah.
highlight reels. There's
Yeah.
always something going on behind the scenes.
Yeah.
Always.
Always, always. And so with that advice, what else would you want young ODs, new grads, or students to know and be aware of if they are interested in taking sort of a similar journey that you have? They're interested in dry eye disease. The aesthetics world is kind of overlapping and they're kind of getting interested in it. What's your final piece of advice for these young ODs that might want to get into this area?
I always say with either business ownership or diving into a very niche subspecialty, you really can only do it if you have passion for it. If
Hmm.
you have a really strong reason, if you have a really clear idea around it, and it's not ego driven.
Yeah.
Yeah.
Um, that being said, There's not a lot to prepare. So,
Yeah.
one thing I often say to my daughter is courage is having fear and doing it anyway. So, if you
Yeah.
Mhm.
feel convicted, I say go for it. I always say shoot for 70% before you launch. You'll never be perfect. So
Yeah.
that's why I push back. I promise you I'm not perfect. I have worked a lot around being very comfortable with not being perfect.
Yeah.
Mhm.
Um, because that's too high of a standard. So get to
Mhm.
70% in launch because if you have an intense calling, there's probably a reason for it.
Mhm.
Yeah.
And it's going to be scary. So practice getting comfortable with the unknown.
Yes. I
I
love
love
that.
that.
Practice
I
getting
know, like,
comfortable with the unknown. I
me
love that.
too.
Yeah.
I'm gonna log off after this and just like wipe a little tear, going like, yeah, I gotta be more confident.
Oh,
No,
Yeah.
that was great. That was wonderful, honestly. Thank you so much, Carly, for spending time on the podcast and sharing your journey. We've known who you are, for
Mhm.
so many years on social media. Some of the things that you were talking about in my head, I'm a lot more on social media, and I'm like, yeah, I remember her kind of going through that throughout the years, like
you
watching you on
watched my
Instagram, just
journey unfold.
Yeah.
How
yeah, and
funny is that?
it is awesome. The I still remember when you announced opening Clear Eyes, and like, we don't know each other personally. I'm not into the dry eye world at all. This is something I'm so removed from. But even for me, I was like cheering you on. I was like, yes. Like, and then she got the residency. And I
Yeah.
was like, oh my God, like this is so, you've achieved so much. And it's definitely inspiring for, other
Mhm.
people watching, just to, like what Deepan said, it is something kind of out of the box, right? It's
Yes.
not
Very much.
following our traditional optometry journey that we, were told that we would have in school. And so, you're just doing a great job, following your passion and doing anything that is going to be good for your patients and good for your soul, for wanting the career that that you worked really hard for. So yeah, thank you again for sharing that. We loved hearing everything about it.
Thanks for having me. This was exciting. This was good. This was good.
Oh, awesome. Thanks everyone for listening to Four Eyes, the podcast series brought to you by YoungOD Connect. Be sure to subscribe and follow us on Instagram or YouTube at Four Eyes Optom for more content. We'll see you next time. Bye.